Hi, my name's Andrew Banis. I'm a registered nurse, and I decided to do my project and my poster on sickle cell disease, or sickle cell anemia. The disease process on the top left, sickle cell disease is an inherited red blood cell disorder. It is a lifelong disease with an average life expectancy of 40 to 60 years. Hemoglobin is a protein in red blood cells that carries oxygen. In sickle cell disease, or I'll refer to it as SCD, the cells have hemoglobin that is abnormal. The abnormal hemoglobin is called hemoglobin S. With this, the cell takes on a crescent moon shape or a sickle. Sickling is when the red blood cell becomes distorted and rigid. This happens because valine replaces glutamic acid at the 6th amino acid of the beta globin chain due to gene mutation. The mutation can be triggered by hypoxia or acidosis. The abnormal crescent shape can cause vaso-occlusion and hyperplasia or thickening of large blood vessels, ultimately decreasing blood flow and oxygen to tissues. The groups at risk. Sickle cell disease is an autosomal trait, so both male and females are affected equally. SCD is also hereditary, meaning people get the disease only if both parents have the trait. Because of this, no age group is targeted. Some of the races affected by sickle cell anemia include African Americans, Hispanics, Southern Europeans, Middle Easterns, or Asian Indians. However, 98% of cases are African American. 1 out of 13 African American babies are born with the trait, and 1 out of 365 is born with the disease. The etiology, bottom left. A child born with the sickle cell trait inherits one sickle cell gene from one parent and a normal gene from the other parent. A child with the disease inherits a sickle cell gene from both parents. The sickle cell gene can be hemoglobin S or another abnormal hemoglobin like thalassemia, hemoglobin C, hemoglobin D, or hemoglobin E. People with one abnormal and one normal gene are carriers and can pass the sickle cell gene to their children. The pathological process, right here. In a normal healthy red blood cell, RBCs, I'll refer to them, with normal hemoglobin, the cell is a donut-shaped and flexible. Those are the normal ones. They're donut-shaped. This facilitates easy flow through small and large blood vessels. The RBC picks up oxygen in the lungs and delivers it to the tissues. When the RBC is sickled from hemoglobin S, the RBC gets stuck or sticks to the vessel walls. This slows or even stops blood flow to the tissues and decreases oxygen to the cells. The sickled cells burst or hemolyze and have a much shorter life compared to normal cells. The body may have trouble keeping up with RBC production and demand, thus causing anemia. The symptoms of sickle cell disease in the middle here, and this is what the sickle cell looks like. It's kind of crescent moon shaped. The symptoms. There are early and late symptoms associated with SCD. Most children with SCD do not have symptoms until approximately 6 months of age, and children are pain-free between pain crises. Fussiness, fatigue, painful hands and feet from swelling, and jaundice are all early symptoms. Children can also be prone to serious infections due to dysfunction of the spleen. The RBCs are trapped in the spleen, causing a decreased circulating volume. Adolescents and adults may also suffer with chronic ongoing pain on top of acute pain. Fatigue, swelling, and inflammation and bacterial infections are common in late symptoms as well. Cardiomegaly from high blood flow may form from severe anemia. Over a lifetime, SCD can harm a person's spleen, brain, strokes are an example, their eyes from retina damage, lungs, acute chest syndrome and pulmonary hypertension, the liver, their heart, just from anemia and heart disease, the kidneys take a hit, penile problems, joints, bones, or skin issues as well, like leg ulcers, are all symptoms. The interaction between pathological process and symptoms, in the middle here. The main problem with SCD is the shape of the cell and its incapability to transfer adequate oxygen to tissues and cells. Acute pain crisis and chronic pain is the most common symptom of SCD. Acute pain occurs because blood flow is blocked and oxygen is decreased to the tissues and cells. Pain can be intense, stabbing, or throbbing, and can be anywhere in the body. Anemia is very common due to the short life of sickle cells. The body often cannot keep up with production. Thus, hemoglobin and RBC levels drop. An acute chest syndrome is a serious condition caused from sickled cells in the lungs that deprive an area of the lungs of oxygen. When oxygen is not exchanged properly, tissue is damaged, possibly leading to infection, chest pain, and shortness of breath. Heart disease and pulmonary hypertension are common due to damaged vessels from sickled cells. Strokes are common because of decreased blood flow to the brain from the vaso-occlusive cells. Next is lab work, up above. Some of the labs you would typically see with sickle cell patients are low hemoglobin and hematocrit levels. A total leukocyte count is usually around 12,000 to 20,000, with mostly neutrophils. Platelet counts are usually elevated. The erythrocyte sedimentation rate, or ESR, is usually decreased. There is sometimes an elevated reticulocyte count. The lactic dehydrogenase levels that are elevated could mean hemolysis from red blood cells that are destroyed. Haptoglobin levels that are low confirm hemolysis. Hematuria in urine with specific gravity similar to protein-free plasma is also characteristic of SCD. Pulmonary function tests are also typically abnormal in children from the breathing issues. All newborns have their blood tested for sickle hemoglobin. That's mandatory in every state. Children, adolescents, and adults can get screened to see if they carry the hemoglobin S gene or other abnormal hemoglobin. Screening can alert people to the possibility of passing it to their children. The last section are the treatments that are available for SCD, and that's the bottom right. There are many treatment options for SCD. However, most of them are directed at easing the symptoms and not a cure. Taking folic acid is a way to speed up red blood cell production. Taking penicillin to prevent serious illness is typical. Doctors might also prescribe pain medications to reduce pain during crisis. Visiting the doctor frequently for checkups is recommended. Some take hydroxyurea to decrease pain crisis and reduce the need for blood transfusions. This medication helps in stimulating fetal hemoglobin production. Other non-invasive treatments include sleep and rest, avoiding stress, overexertion, extreme heat or cold, and drinking an abundance of water. Blood transfusions are a more invasive treatment for when anemia is severe and hemoglobin or red blood cell counts are low. The only known cure for SCD is a bone marrow transplant, although this treatment is very risky, very painful, and often rare because finding a donor can be difficult. Usually they look towards family members, siblings mostly. This is the presentation on sickle cell disease. Again, I'm Andrew Banis, and I thank you for listening.